Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Dr. Saeed Hassan and Dr. Hamid Merchant from the University of Huddersfield Department of Pharmacy. And we're talking about a study concerned with the use of antidepressants during the coronavirus pandemic. Why don't you start by introducing yourselves?
I'm Dr. Hamid Merchant. I am subject lead in pharmacy at the University of Huddersfield. I am a pharmacist by training, but I specialises in drug discovery and development. I have about 18 years experience in formulations and drug discovery development in academia, and also I've worked in pharmaceutical industry. And I still work with some industries in formulation support and formulation development and trials.
Yeah, I'm a pharmacist by training and working as a senior research fellow at University of Huddersfield. I have worked in 4 different countries as academic staff and also a researcher. My research mainly deals with clinical pharmacy, evidence synthesis, and pharmacoepidemiology. So we look at the use of the drugs at population level, especially using meta-analysis and systematic reviews.
You published a study in March in which you investigate trends in prescribing and costs of antidepressants during 2020 at the beginning of the pandemic. Could you start by saying a little bit about the background to this?
As I have mentioned, that we are interested in, the use of drugs, at population level. So we were doing, looking at different drugs, different treatment options for COVID-19. For the treatment of COVID-19, also the issues related to COVID-19, such as mental health issues. There was a series of lockdown, a national lockdown, regional lockdown, that actually leads to a lot of, jobs lost by the people staying at home, not working. So there were serious, mental health issues, people were facing. And we also noticed there was an increase in the prevalence of depression during this period. So we were interested in looking at the prescribing trends of antidepressant drugs in primary care England. We want to know, the prescription patterns, number of prescription dispensed, the cost on treating depression in primary care, and comparing it with the previous years, so we can see whether we are using more antidepressants during the pandemic, or we are using less.
So what did you find?
And our main findings were, if you look at the prescription numbers, we noticed there was 4 million more prescriptions prescribed during the pandemic year 2020 compared to 2019. But this increase, 4 million increase in the prescription items, was almost similar to previous years, 2018 and 2017. Our main observations were actually related to the cost of antidepressants. Especially, they were using more generic products, and their prices were doubled. And if you look at only one drug, sertraline, is hugely prescribed, and the cost was significantly increased. So there were like about 113 million pounds spent on one drug during 2020. So we noticed a significant increase in the spending on antidepressants. We also noticed, there was more generic products were used at a very high, cost. Their costs were significantly increased compared to 2019 and 2018.
And how do you explain these findings?
As Dr. Hassan said, that the trend, if you look at the overall trend and look at the historical trend in antidepressant prescribing, you would always see there is an increasing trend year by year in the use of antidepressant, not only in United Kingdom but also in United States. So if you look at the annual trend, you wouldn't be surprised that there was predictable difference from previous years. But if you look at the monthly trend, you might see a very big peak of antidepressant prescribing in April and May 2020. So that's where you start dissecting the data. You see there's something going on at the peak of pandemic there, where you found this surge even in the quantity dispensed. And then in April, when the borders shut down, lots of imports, exports were affected, particularly the shipments coming from China, who basically dominates the major share in the active pharmaceutical ingredient production. So lots of European companies who would make formulations of antidepressant drugs and other drugs would receive raw materials from India and China. And because of that border shutdown, the raw material went in shortage, and many generics, which were like £1 a pack for a 30-day supply, would have gone to 20-30 pounds a pack for a 30-day supply. And often generics became more expensive than the branded products, which brought the cost really high. As Dr. Hassan was saying, that we had 130 million pounds extra spent only on the cost of drugs. And that was disproportional to the items dispensed. And what was surprising was that supply chain was interrupted for a shorter period of time, but the cost did not come down even towards the end of the year and the beginning of the next year. And some of the supply chains were maintained by some EU manufacturing operations, which shouldn't have been affected by the shortage of materials coming in from the other countries. So we felt there might be some opportunistic cost behaviors which were not as tightly controlled as it could have been. And that money which had been spent extra on the drugs could have been rather commissioned on mental health services, which were shut down.
Thank you very much. That was very interesting. Much food for thought there. For more information about this study and the work done by Dr. Hassan and Dr. Merchant at the University of Huddersfield, please visit our website using the link in the description, and be sure to sign up for more news, videos and journals. For information directly to your inbox, please sign up using the link below. And thanks for watching.